in a world where a billion people live in extreme poverty, dying from hunger or lack of clean water, 1 in 4 deaths are from completely preventable causes or treatable causes like AIDS, TB, malaria, diarrhea. I think the global health disparities gap has to be the #1 pressing issue. There's a term called the implementation bottleneck, and what that is on one side we have a pipeline of known life-saving technologies. Take antiretroviral therapy as one example, but many more like that. And on the other side we have millions, billions of very poor people who need those technologies, but we lack the systems to develop that, to deliver that care, and that's a bottleneck between the two sides. And figuring out how to implement those systems is going to require lots of different skill sets. There are folks we need clinicians, obviously, to work on the ground, but one step behind them, we need implementers, people who understand the work of clinicians, but are also plugged into the systemic issues, the supply and demand issues, the political nuances of how we build momentum, consensus, how we actually effect system-wide change. Supporting those folks are the social scientists, for example, who report on the impact of that work and spread the good word so that others can decide if they want to follow suit. There's a huge role for those who are actually intelligently raising and channeling funding to the problems that are going to make the biggest difference. There's so many angles of engagement. So I think that's one of the good news messages to health profession students is there are many ways to be passionate. There are many ways to make a difference. So I encourage anyone who decides to work in a developing area, especially, but probably in any setting, to approach it with humility, to make sure that their eyes and ears are open, they're listening, they're really allowing the people they're working with, their partners, to tell them what problems matter, how to make a difference. And I'll give one analogy. I think one thing I've sort of learned over the last really year and a half is that getting things done, making change in the developing setting is somewhat like standing at the top of a sloped driveway and tossing a bucket of water down it. The water is going to flow downhill, but it's not going to flow equally in all areas. There's areas of greater flow, trickles, and some areas where there's no water at all. And if you try and work in one of those dry areas, maybe you can push some incremental change while you're there, but it's going to evaporate when you leave. The key is being able to recognize where that flow is brisk in terms of partners, resources, political will, and so on, and then deciding that that's where you're going to make a difference. Finding a match between what seems to be needed and wanted, and what you're passionate and able to accomplish. And I think that's good news for students, because I remember as a student myself, I would often feel like I didn't have any power to change things when I went to a setting. But I think that will come later for students. But what you can develop very much is that sensitivity, that ability to learn to listen, to be culturally sensitive, and to recognize where that water is flowing more quickly, to recognize where the consensus is, and then when you do have the chance to actually act and implement, be much more effective.